Hello and welcome to our session, Postgraduate Psychology at Macquarie University. My name's Hannah and I'm currently in my honours year of our Bachelor of Psychology degree, and I'll be speaking with our course directors for our 4 postgraduate psychology master's programs. So we have the widest range of offerings in New South Wales, including the only master's programs for both clinical neuropsychology and organisational psychology in the state. So depending on your areas of interest, this is a great way to have a look at the career options and just kind of the course structure and entry requirements. So hopefully we can answer some of your questions today. Before we begin, I'd like to acknowledge the traditional owners and custodians of the land. We're currently on Wallamadigal land of the Darug Nation. So today I'm here with Professor Joanne Earle, who is our Master of Organisational Psychology course director. Thank you for joining us.
Oh, I'm really pleased to be here. Thanks for having me, Hannah.
No worries. So today I guess we'll start a little bit with kind of what are the kind of pathways or career options that you can get from organisational psych, because I know this is a really, really common question.
It is. And I think people would be surprised at the number of organisations that have organisational psychologists. So most large organisations nationally and internationally, a lot of organisations in banking, finance, insurance, but also within the community as well. So, for example, the Royal Fire Service. And it's also probably interesting for people to know that a lot of roles are emerging. So the roles that we talk about now, there'll be new roles in 2-3 years' time. So, for example, one area that's been really in growth is risk management in banks, for example. That's a area where it's mostly serviced by organisational psychologists.
Yeah, because I know kind of a lot of people that I interact with in my course, they know that kind of human resources in the corporate are often common, but it's really good to know that there's a wide range of career options and that kind of thing as well that you can go into, which kind of definitely expands, I guess, the career options. Yeah, definitely.
So organisational psychologists might work alongside HR practitioners as well,
yeah,
but we're more likely to be brought in as specialists in different areas like learning, training and development, psychological assessment, organisational change and development, leadership, staff appointments and staff management. So we might be helping to recruit, large cohorts of new graduates, for example.
Yeah, well, that's really good to know. How about our entry requirements? So what are the kind of requirements that we should be looking for to apply for a Master of Org Psych?
Well, we always look for a good GPA, so we want to look for some consistency across the course. We're looking for an honours degree or the 4th year equivalent and at least around a 2A and above. And we also look at work experience. So we're interested if we can see some alignment to organisational psychology and work experience, but it could be customer service, it could be retail, it might be interviewing or working with people in some sort of leadership capacity within the community, or counselling skills. Sometimes people have done some counselling skills. All of those things we look at. The other thing we look at is a motivational statement. The best motivational statements we read are those that understand what an organisational psychologist does, and they've linked their strengths and their attributes to what the organisational psychologist will do. Yeah. So we're looking for that nice match between here's what an organisational psychologist is, I believe, and here's why I think I'm suitable.
Yeah. I guess you want to know that people are passionate about the subject as well.
Definitely.
Yeah. So I guess from that, if say you are then admitted to the Masters, what is that pathway like into becoming a registered psychologist?
Right. So once you finish the Masters course, you can get general registration. So you become a psychologist as soon as you finish the 2-year Masters course, and you put in your application, of course. But once you've done that, then you go into a registrar program. And the registrar program allows you to get supervision over about 18 months with a endorsed supervisor or a recognised supervisor, and then you'll become an organisational psychologist.
Okay, so I guess with that registrar program, can you just clarify what is a registrar?
Yeah, a registrar is really someone who's already generally registered and then they're working towards an area of endorsement. So in our case, it's organisational psychology.
Okay, that makes sense. And I guess before we kind of wrap up, what is that, because I know you mentioned that I guess there's some practical elements of that Masters as well.
Yeah,
what does that practical element look like? I guess in terms of the time, you know, how you can be recognised by employers and that kind of thing.
Sure. So the course really has a number of different components. There's coursework, and it covers off some of those topics I spoke to you about before. So psychological assessment, teams, wellbeing in organisations, etc. So all of those different topics you would cover. You'd also do a research project that's aligned to an area of interest, and you'll do placements. There's 1,000 hours of placements that we organise, usually over 3 different types of organisations. So we're trying to give you the widest possible exposure to different areas of organisational psychology, so that by the time you've finished, you're able to make a really good, informed decision about what you'd like to do in your career.
Yeah.
And it also exposes you, very fortunately, to some employers of organisational psychologists. So it's really an opportunity for you to try them, for them to try you, and to see how it fits, as well as developing competencies that match the course content that we've taught you.
I think it's really good because, especially in my undergraduate degree, having that theoretical knowledge is great. And I think then going to the masters and being able to apply it is really, really important as well.
It is. And we help with that. We help find the placements and organise the supervisors, because that's a really big undertaking in itself.
Yeah.
And I think it's one of the points that differentiates our program as well, in that what we have is a placement coordinator, and their role is just to help you to navigate the paperwork and to meet the supervisors and to bring the supervisors on board so they understand what the students are going to need to do and what our requirements are.
Great. And just one last question. What do you love about organisational psychology?
Well, I've been an organisational psychologist for quite some time now, and I can tell you the variety is amazing. So I started off in occupational rehab, and then I worked in internal consulting in an organisation as an organisational psychologist. And then I went from there to work with an international company that was the Gallup organisation. So I went to Omaha in the US to do my training with them, and then I worked out of the Australian office and managed Australia and New Zealand research projects for them. So it's been an amazing opportunity, and that's why I love what I do now, to give that next generation of organisational psychologists the opportunity to have a career that's been as rewarding as mine.
And you've definitely had a wide range of things as well that you've been able to do.
Yeah, one of the other jobs was training manager at Pepsi Cola.
Oh, wow.
Lots of side benefits.
Oh, yeah, definitely. Well, thank you so much for joining us, Joanne.
My pleasure.
I'd now like to introduce Dr. Josephine Paparo, who is our course director for a Masters of Professional Psychology. Thanks so much for joining us today. So I guess I've just spoken to Joanne, who was our organisational psychology course director. I guess one of the main questions that I know that a lot of people around me have is, what's that difference between professional psychology and things like organisational psychology and especially clinical psychology?
I'm not surprised it's a question a lot of people have. It's one that I get a lot too. So really what we're talking about with the Master of Professional Psychology is that students gain a really diverse array of skills in working in psychological professional roles, whereas in, say, the organisational psychology program or clinical or neuroclinical program, it's a lot more specialised training in those niche areas. So what we really end up with in the Master of Professional Psychology program are psychology all-rounders.
Yeah. So I guess we did talk about before in the org psych was that, I guess, structure of the master's program. Is it kind of a different structure for professional, and what's that like?
Absolutely, they're quite different. So the Master of Organisational program, alongside the other 2-year master's programs, are 2-year master's programs, whereas the Master of Professional Psychology program, students are with us for 1 year only. Doesn't mean that they then go off into the world untethered after that. They then do what's called a 1-year internship program following their time with us. So really doing what a lot of those students in the 2-year programs would be doing in their second year at university, but in a more on-the-job training kind of model.
Yeah, okay. And so I guess with that and that journey to become registered after that, how does that kind of work?
Yeah. So the Master of Professional Psychology program is part of what the Australian Health Practitioner Regulation Agency or Psychology Board of Australia calls the 5+1 pathway to registration as a psychologist in Australia. And so what that means is after students do their 4-year accredited sequence in psychology. They come and do what's their 5th year with us, that's the 5.
Yep.
And then they do their +1 internship here.
Yep.
And then following that, students undertake what's called the National Psychology exam, and upon successful completion of both those elements, they can then become a registered psychologist.
That's great. And I was talking before about how it's really good to have, I guess, that focus on applying all the theoretical knowledge that we've learned in the practical field then. And I think it's a good way to kind of transition
Absolutely.
as well.
It really gives that opportunity to get out into the workforce as quickly as possible for our graduates.
Yeah, and definitely like the networking opportunities and that kind of thing, I'm sure is really good as well. So with that 1 year internship that you were speaking about, what are kind of some examples of things that students may go into in that 1 year internship?
Yeah, great question. So again, reflecting the ethos of the program of being about diverse, broad roles, they might go off into a range of different contexts. What one student does in their internship year might be really different to what another student does, but essentially the structure of that 1 year internship is the same. So they're going off, getting some practical experience working as a psychologist full time, and alongside that receiving some really comprehensive supervision, as well as completing some other requirements for that internship program. So submitting some case reports and, as I said, that national psychology exam. And we have students who go off into a range of diverse settings for that. So at the moment we've got graduates who are working in school environments as school counsellors and psychologists. We have other students who are off working in the Department of Community and Justice, corrective services, and some are even working in privately or publicly listed companies. So taking that organisational slant, but in the context of a professional psychology role.
Yeah, I think it's good that it's nice and broad as well. So you're not kind of set in on a specific thing, which is really good. So I guess in the sense of kind of going back to the masters specifically, what kind of person or student would you say should be kind of considering going into that masters, or what kind of interest may they have?
Yeah, I think someone who is attracted to that idea of the diverse skill set and gathering that broad range of skills, someone who maybe doesn't want to narrow down their options to one particular type of area of practice, is a really good candidate for our program.
Yeah.
It's also someone who does have that eagerness to get out into the workforce really quickly, rather than spending 2 years at university. Having just that 1 year with us can be really attractive for those kind of students. It really is about wanting to gather those range of skills to work with various populations and make as broad a contribution to psychology as you can.
Yeah, lovely. And just before we wrap up as well, what will make someone, I guess, what will give someone that competitive edge in terms of getting into that master's program?
So it really is a unique person that we like to take into our program who is attracted to that very diverse opportunity that our course affords. And so someone who shows a clear preference for a program like ours is certainly something that we're looking for.
Yeah.
We're also really keen to take graduates who have demonstrated their ability to undertake a rigorous academic curriculum. So based on the completion of their 4-year undergraduate training in psychology. We also want to hear what others who know you have said about you. So we look at referee reports as well. And finally, very important for us is looking at the kind of work experience that someone brings to a program like ours. We're looking for people who've had some on-the-job training already, working with clients or in a practical space where we can see that they can demonstrate that they've already got that aptitude for the kind of skills we're trying to cultivate through our course.
Yeah, I guess what we mentioned talking to Joanne about the organisational psych as well is people being just passionate about what they want to do and keen and that kind of thing. Would you say that's kind of similar?
I would say that's probably the key attribute that we're looking for, someone who really wants to do our program, who's driven to work with and help others, and who can show that real commitment to a scientist practitioner model in wanting to assist people in their psychological recovery.
Lovely. Thank you so much for joining us today, Josephine.
You're welcome.
I'm now joined by Dr. Heather Francis, who is our course director for our Masters of Clinical Neuropsychology. Thanks so much for joining us today. So I'm really excited to talk about this one because it's my area of interest, but I guess some people may not know what neuropsychology is. So can you tell us a little bit about what it involves?
Yeah, sure. So neuropsychology is a subdiscipline of psychology with additional training in understanding brain behaviour relationships. And I guess when I'm talking about behaviour, I mean anything from cognition, but also behaviour, emotion regulation, mood, understanding how different regions of the brain affect things like memory, attention, mood, and then also understanding what happens when things go wrong with the brain. So someone might have a stroke or a neurological condition like multiple sclerosis, and it's about understanding the patterns of cognitive change and mood change that go hand in hand with a lot of those neurological disorders.
Yeah, so I guess because it's that specialisation, I guess some people may want to know what kind of graduate roles do people often go into from that Masters in Clinical Neuropsych?
Yeah, so the majority of neuropsychologists probably work in the hospital setting, so we'd see inpatients and outpatients, and be sort of, integrated within either neurology wards or neurosurgery, brain injury rehabilitation units. And then usually we'll sort of tend to subspecialise within that, either to sort of paediatrics, so dealing with children who have either a specific learning disorder or intellectual disability, or paediatric epilepsy, for example. And then in the sort of more adult sphere, it can be in sort of more general neurology, seeing a range of different neurological conditions, or in older adults, differential diagnosis of dementia. So understanding, for example, how the most common dementia, Alzheimer's disease, differs in its presentations from, say, a frontotemporal dementia or some of the other movement disorders that affect thinking.
Yeah, I guess it's really good to know that even though it's a specialised field, there's still so many options that you can go into.
Yes,
which is really good.
It's very diverse.
Yeah.
I should say that, apart from the hospital setting, neuropsychologists will often end up in research as well, either sort of affiliated with universities or other major research institutions. And also, in private practice, and not just seeing patients clinically in private practice, but often going a little bit further to be medico-legal. So that might be, as an example, someone's been involved in a car accident and that's affected their ability to work and they're seeking compensation, doing a really thorough assessment of their cognition that would stand up in court, essentially.
Okay, so in terms of the master's program specifically, what do those entry requirements look like? Are they, because I know we spoke about them in our previous interviews with organisational and professional psych course directors. What does that kind of look like for neuropsych?
So it's very similar to the other programs for neuropsych, where you need to have an honours degree and it's very competitive. So having a very strong academic transcript, but we also look at references and relevant work experience.
Yeah, okay. So I guess with that, what might draw someone to neuropsychology specifically rather than kind of the other master's programs?
So I think it would be obviously having an interest in how the brain works and what happens when things aren't working. But also really, the great thing about neuropsychology is you get to work with a range of disciplines. So I'm in a neurology department, I get to work with neurologists and neurosurgeons and all the allied health, like the physios and the occupational therapists and the speech therapists. We work together to really improve the experience of the patient and their family. I love that aspect of my job. And often we're, as neuropsychologists, the specialty that gets to spend a lot of time with a patient, really delve into what's going on for them in a way that I think a lot of the other professionals in the hospital setting don't necessarily get time to do. I think that's really rewarding.
So I guess in that field, obviously that's kind of the role of the clinical neuropsychologist. But for someone who is in that undergraduate degree still and is looking for that work experience for the entry requirements, I think this is a lot of my friends as well, like have questions about this. What specific neuropsychology experience can people look for that?
Yeah, so we recognise that it's really difficult to get experience with people with neurological conditions simply by nature of that it's a very sensitive area. But, you know, what we would look for is, so you can either seek out work as an RA with any sort of research studies where they're looking at any sort of condition or any sort of cognitive testing. And then other sorts of relevant work experience would be anything that involves even basic counselling. So Lifeline is a good example. Settings where you can demonstrate empathy. A lot of people will end up working in, for example, behaviour support. A lot of people will have experience, say, working with kids. But really, I guess what you'd be wanting to try and get out of that work experience is a good reference that can speak to your empathy, your ability to relate to people in difficult circumstances, and also sort of a bit of independence and motivation and drive, that sort of thing, because those are additional skills that are needed to succeed in a master's program apart from the clinical skills.
Yeah, and I guess the common theme throughout all of these is your passion for it and that you want to pursue that specifically, I guess.
Yeah, absolutely.
Yeah. So just before we wrap up, I guess I wanted to ask, you did mention a little bit before, but what specifically do you love about neuropsychology? What led you to become an academic and a clinician in that field?
Well, the reason I think I've become an academic is that I love teaching neuropsychology. I find, you know, following the students' progress over the masters and their growth in knowledge really just fun to be a part of. And then I also love that being an academic, you get to be, part of your job is to know the latest research. And then that helps inform my clinical work and make me a better practitioner. So academia is great for that.
Yeah, and I guess having that mix of the academia and then also going and working in clinical practice kind of mixes it up a little bit as well. And I feel like that would be kind of cool.
Yeah, and you do find, so there does seem to be quite a demand for neuropsychologists even without the additional PhD to be involved in research. So we do find a lot of our graduates will end up doing a bit of clinical and a bit of sort of working in those sort of research settings. So it's definitely a possibility on graduation.
Lovely. Well, thank you so much for joining us today, Heather.
Oh, it's been great. Thank you.
So now I'm going to be talking to Associate Professor Philip Gilchrist, who is the course director for our Masters of Clinical Psychology. So welcome.
Thank you.
So we have had a bit of a conversation before about with our other three course directors for the Masters, where we spoke a little bit about our opportunities and about kind of what careers you can go into, the pathway to becoming registered. So kind of going to that special neuropsychology, but then also the broader areas that you can do in professional and organisational. So I guess with clinical psychology, what can people that are going to pursue that kind of find themselves in the career space?
Well, clinical psychologists become experts in assessment, diagnosis, and treatment of a wide range of psychological and mental health issues. So as such, they could be involved in a wide variety of settings as well. So for example, community-based services, private practice, private clinics, hospitals, and so on. But an important point to make is that it's not just psychotherapy. So clinical psychologists could work as well in consultancy, public health, forensic testimony, program development, that sort of thing as well.
Yeah. So I guess it is a common misconception that psychotherapy is the only thing. Sure. So I guess my next question then is, for things like the placements and the internships in that master's program, do students get the chance to kind of have a bit of a broader opportunity to explore kind of their specific interest in clinical psych in those placements?
Definitely. So we have 3 placements in our program. 1 is internal, 2 are external. The external ones vary widely. So the areas I mentioned earlier, private clinics, hospital settings, schools, and so on. these are representative of the types of external placements we have. And students have some degree of choice in determining where they end up for their 2 external placements.
Yeah, so I guess another question for you is, what do the entry requirements look like for our clinical psych masters?
Right, so it's similar in some ways to the other programs. So we're looking for first class honors or second class division 1. We're also looking for, in addition, you'll see this in the supplementary form, we're looking for information about the type of relevant experience that you may have had. If it's relevant is a subjective term, so any type of experience you do have, please describe it. But if it's something that's relevant to the area of clinical psychology broadly, then I'd encourage you to emphasize that point. So, for example, many of our successful applicants have had experience with Lifeline, and there they may not get many hours. They might get a few hours every other week or so, but it's an excellent example of a good experience because there's some training there, it's client-facing, and they're applying some of the skills they've learned in their undergraduate to a workplace setting. So that's what we're looking for. We're not looking for anything beyond that. So we're not looking for having experience in conducting therapy, of course, nothing like that. But I think that would be a good example, something like Lifeline. Yeah.
So I guess for people that are going through to kind of pursue that or go through those entry kind of processes, why do you think that they should kind of consider Macquarie specifically?
Well, I think there's a number of advantages at Macquarie. We, as I mentioned, have that in-house clinic. So it's unique, and it does place students with an advantage when being sent out to those external placements. So because of the in-house clinic first placement, they've had close supervision for an extended period of time, many months, to upskill. So by the time they're heading out to their external placement, they've gained some confidence and some skills in a variety of areas of assessment and some therapy as well. So that's one advantage. Another advantage is the team that we work with. So I think we're a great team. We're down to earth. We're not just academics. Our team are all experienced clinicians as well from a variety of different settings. So we have experts, leading experts in different areas such as anxiety disorders, PTSD, for example. We have experts in OCD, child health, adult mental health, as well as clinical health psychology. So a variety of different expertise in our program, and an emphasis on not just the academic features, but the applied features.
Yeah, great. Well, thank you for coming to chat with us today, Phil.
Oh, thanks for having me.
So that's about time to wrap up now. Thank you to all of our course directors for coming and having a chat with me today. Hopefully this has kind of answered some questions and kind of given an insight into the pathways to becoming registered and some of the entry requirements for maybe joining one of our master's programs here at Macquarie. So if you have any further questions, please don't hesitate to contact us. But thank you.